Hello, everybody. My name is Banerjee. I'm a professor of clinical data science and a cardiologist at University College London, and I'm leading the STIMULATE-ICP study. The STIMULATE-ICP program is funded by the National Institute for Health Research and has, since 2021, been doing a series of different pieces of research, including a complex trial, which is looking at a pathway which includes a multi-organ MRI scan called CoverScan, a drug platform study, which I'll come back to, and a digital rehabilitation platform called Living with COVID Recovery. And it's looking to see whether these aspects together and individually are effective in getting people better from long COVID. So we are now in October 2023, and by way of progress update, previously we were only recruiting people who are newly referred by their GP with long COVID, and we have, after several teething problems and delays, been able to now have amendments accepted so that we can take patients who have previously received care or been diagnosed with long COVID, and they can be recruited into the study via our existing and new sites. And also, it's possible for people to come into the study for drug only, as in the overall pathway, including the scan and the digital rehabilitation, is not needed. They can come just into the drug trial. On the call today, I've got Dr. Melissa Heightman, who is the national lead for long COVID NHS England, and also is a respiratory physician and lead for post-COVID services at University College London hospitals. And Rachel Hext is my colleague and nurse, and she is also a key member of our PPI group, public and patient involvement at the STIMULATE-ICP study. Mel, can I come to you first? Would you mind giving us an update on the long COVID situation as it stands at the moment? Thank you.
Thanks, Amy. So obviously, we all know that COVID infections are continuing, and unfortunately, we're still seeing that some people can develop long COVID illness, even at this time point in the pandemic. So the referrals to our long COVID clinics in the country are continuing at a steady rate. So I think one important message from us is, if you're still feeling, if you've developed illness after COVID, please do speak to your GP and discuss whether you should be referred to one of the clinics. They continue to operate. They're open for into the future as well. And from next year, they'll be moving into being provided as part of the normal offer within the NHS. So please don't think that these services are shutting. So that's the first message. The second message is that we've done an awful lot of learning in the last 3 years about how to help people manage this illness and how to support their recovery. And we're seeing a few things in the information that we've collected from people who've been through the clinic. First of all, we know this is a really difficult illness, and for many people, the symptoms do last a long time. But we're starting to see signals that if people access the right support early, they can do better, and that the support of the long COVID clinic makes a difference and can improve your recovery. So again, please do seek help and speak to your GP about getting a referral. And one of the really important questions is how we can improve recovery even more. So really do encourage people to be accessing this trial if it is suitable for them. And we can talk a bit more about what makes you suitable for the study, can't we, Amy, in this conversation? Thank you.
Thank you. Thank you, Mel. Rachel, uh, I wondered if you had any questions or any reactions to what you just heard.
Thanks, Amy. So really coming back to what Mel was just saying, as someone with long COVID who is approaching their 3rd anniversary now, is there actually a way forward for people who are similar to me and have had this for a long time? And, you know, is it too late for us to get treatment? Where would we stand with that?
Absolutely not too late, Rachel. And many of the people who come through to the clinics have been poorly for a long time. But we're seeing that with the right support, we've got at least a third of the people we're seeing telling us that they're definitely seeing improvement in each time point. Obviously, that's improvement, not cure. But those improvements can add up to be something really important that make your life more manageable. So it's something that we've got to keep proactively working towards. So absolutely never too late. And now even patients who've been ill for a long time and maybe seen in their long COVID clinic before can still be included in the STIMULATE-ICP study due to the changes in the protocol that have been approved.
Thank you. That's really helpful to know. And I think a big consideration for people who've had long COVID for a long time is whether they're well enough to even attend a clinic. I think it's been a real case of some people not actually being able to get access to adequate healthcare because they are too unwell to. Social media is full of posts of "I've not seen anyone because I can't get there" and things like that. What you know, what's your answer to that? What's your thoughts on that?
So I think it's really important that someone with long COVID has at least one assessment in person so that you can properly understand how the illness is affecting them and make a safe plan for them. For people who have significant disability from their illness, they should be able to at least access NHS hospital transport. That would be one option. Some services have an offer where they can do home visiting as part of the assessment as well. But I think it's something that really, I hope that person could absolutely prioritize at least once getting to an in-person appointment. And after that, everything nearly everything can be managed virtually. Sometimes you need to come up again for some other tests, but please don't let difficulty getting to the building be a complete bar. Contact the service, let them know the problems you're having, and ask for their help in finding a solution.
Thank you, Mel. That's really helpful. Amy, I've got a question for you, please. For people who have had long COVID for a long time, I think often the consensus is that they feel a little bit let down and a bit forgotten. So where it's an amazing opportunity now to be able to join the trial if you have had long COVID for a long time, can we talk about the eligibility for it so that, you know, people are really aware where they stand with this? Because I would hate for people to get their hopes up if they weren't eligible.
Thank you, Rachel. So in order to be eligible for the study, you need to be an adult over 18. You need to be having symptoms of long COVID that have persisted. So that's obvious. And the new part is that you could have been diagnosed previously and have received treatment before. Previously, we were only taking people who are newly presenting, and we need you to be referred via your GP. And we have existing sites, for example, Mel leads one site at University College London Hospital, or there's one in Derby, there's one in Leicester, for example. But we're also opening several new sites. And if you're referred to one of those new sites, for example, in Oxford or in Tameside or in the Royal Berkshire Hospital in Reading, then we can include you in the study. That's the way to come in. But people who've had symptoms ongoing and have been unwell for a while can be involved in the study. Absolutely. There are for the particular drugs which are colchicine, rivaroxaban, and an antihistamine combination, there might be particular contraindications, meaning reasons that people can't be in that particular arm of the study. But the eligibility criteria mean that people who have had the symptoms for a while can be involved.
And where would it stand for people who may be on some sort of treatment, but perhaps not all the options available in the drug arm? Would they need to stop their medication?
Great question, Rachel. So at the moment, and if it's new people joining the study, we ask people for a 1 week wash out period, which means when they stop their existing medications for at least a week. And then depending on what they've been allocated to, that's what they'd take in the trial.
Sure. And Mel, if you know, there are still within the long COVID community a lot of people talking about how they feel their GP isn't up to scratch on long COVID, or a sense of disbelief, even gaslighting on some occasions. What would you suggest is the best way to approach your GP when you're asking them potentially to refer them to you know, say your practice that they might not be familiar with?
So quite a lot of information has gone out to GPs in the NHS to try and support them with making a right diagnosis of long COVID and giving them guidance on when to refer. There are some publicly viewable documents that you could reference in that conversation with your doctor, such as if you Googled the commissioning guidance for post-COVID services, it goes through decisions such as when to refer somebody to the long COVID clinic. And I think just signposting them to this publicly available information could help the conversation. I think a lot of GPs are doing an absolutely brilliant job at managing long COVID. And sometimes it might be the case that it's helpful to have a conversation with a different person in your practice. Or you can raise a question as to who in the practice has the most experience of long COVID that you could talk to.
Yeah, absolutely. Could you explain a little bit what might be expected of anyone who wanted to join the trial, and what the sort of timeline would be, please?
Yeah, absolutely. So the steps would be, number one, going through information with the person just to check that they were eligible for the trial and that this was a suitable study for them. And then they would come for the first visit, where they would go through the consent form, and they would be given some questionnaires and offered blood tests to be taken. And then they would be randomized to one of the treatment arms, one of the 3 medicines, and some people are randomized to not have medicines. The study period is 12 weeks, and then there's another visit at 12 weeks, which is often done virtually if that's more comfortable for the person. But in our site, they also run those face-to-face as well. There's more questionnaires to answer at that point too. So probably for the person with long COVID, filling in the forms is the bit that can be quite tiring. It's something that you can take your time with. We have options for allowing you to take away a paper form and doing it more slowly if needed, or sitting with the research nurse and going through it with them. But we've tried to keep the number of appointments connected to the study as few as possible. And obviously the research team are available for the person to contact if they have questions or any problems once they're started on their treatments.
Thank you, Mel. Amy, a quick question for you, please. So far, the study has taken people newly presenting with long COVID. what benefit to the study is there for people who may have had long COVID for probably several years now? What will they contribute to the study?
Oh, they'll contribute hugely to our understanding. And the reason previously we hadn't included them was to try and understand the early trajectory, and if you like, simplify the question that we were trying to answer. But now that we have experience, and we didn't know, Rachel, a couple of years ago, that this could last for a couple of years, and so now people like yourself would be adding to our knowledge about the disease itself, but also adding to our knowledge about whether treatments work in established long COVID. So very, very much a case that people with established disease contribute.
Yes, thank you, Amy. I think from someone with long COVID who's had it for, well, nearly 3 years now, I'd like to thank you both for the opportunity to open it up to people who have been, well, out and about with long COVID for quite a while now. It has at times been quite a lonely journey, and I'm particularly excited about this part of the aspect of the trial because it's opening up to people who have suffered with it for a long time. And I think there's a lot of people in the long COVID community who haven't had the opportunity to contribute, who really would be willing to. So I just want to thank you both for the work you're doing on this study, but also for the opportunity for a wider group of people with long COVID to contribute to it. So thank you for that.
Right back at you, Rachel. So thank you to you and patients and public who've kept our eyes on the ball, whether it's in the research or in the clinical community, and you know, we need to make sure that continues. I wanted to make a point that the study is currently funded and agreed to continue until December, and that's being extended to March of 2024, and we're hoping that it might be extended further than that. And so we need people to come forward sooner rather than later to join our study, and we hope that if we have enough people recruited to answer the questions of the initial drug selection in the drug platform study, that later either this study or others will be able to look at other questions, because we need to be able to show the research community and the clinical community and the patient community that we can recruit and do trials efficiently and quickly in people with long COVID, and we know that this is a major health problem, not just individuals at population level. So please do come forward and help us do this research to answer the important questions, so that we can move forward and look at other treatments and other drugs as well.
Yes, absolutely.
I'm going to draw us to a close there, but if people have any queries or questions, then please go to our STIMULATE-ICP trial website. There's information sheets for the study. There's a contact email if people want to get in touch, and there's more materials and more talking heads like ours to tell you more about long COVID and other aspects of the study as well. Thank you.
Thank you.